American healthcare system has seemingly resurfaced as a leading issue in America. The problematic use of the American healthcare system can create life-threatening problems such as decreasing life expectancies. In 2010, the Central Intelligence Agency, CIA, estimated that life expectancy in the United States was worse than in 50 other countries in the world, including in some far less wealthy nations such as Jordan or Greece. This significant issue impacts almost everyone in the United States. Although some may not employ the American healthcare system, they will still be affected politically or economically. Healthcare has proven to be a significant factor in the United States' financial transactions and has steadily increased at around 2.5 times the core inflation rate in the economy over the past 50 years.
Good afternoon. We're here with Mr. Greaves, and we're going to be interviewing him about what he believes about the healthcare system. So, Mr. Greaves, what do you believe, and what is your perspective on the healthcare system?
Well, my perspective on the healthcare system is kind of, I would say, a little bit on both sides. I agree that everybody needs healthcare, and the healthcare system is in place so everybody can get proper treatment. But there's also portions of the healthcare system that if you don't have a job or if you're not sitting in a profession that provides insurance, healthcare can be very difficult.
And how would you change or improve healthcare?
Well, I'm not an expert, and I'm fortunate to be one of those that has a profession to where healthcare is provided in my salary. But if I did have to make a change, I would say that there's something that needs to be done for those people that may not have a job that provides insurance, that may have to pay the high premiums. Something has to be done for those people to still get treatment and then not be hit with a bill that some people spend the rest of their life having to pay.
In this moment, we're here with Nurse Gabby, and what's your perspective about the healthcare system?
The healthcare system, I believe, is a good thing to have. It's to help people with diagnosing, treating them, helping them live longer, getting them specialized care and medication when needed.
And how could you improve, or what change could you make if you had the possibility to do so?
I would definitely improve the funding. I think there needs to be more funding going towards research and diagnosing and treating and curing. There's a lot of things we don't have cures for, and I believe extra funding would help with cures. And definitely, lower the healthcare costs. A lot of people cannot afford it because it is very expensive.
We're now with Ms. Edmonds, and she is going to explain to us what her perspective is on the healthcare system.
Okay, so this is a very, very broad question, but there's a couple of key things that I have opinions on. One is the way insurance dictates some of the care that people get and override what doctors say is necessary for a patient when they have never actually seen that person. So that's a very big problem, and the hoops that people have to jump through in order to get the care that they need because of their insurance. Another opinion that I have about it is that not enough people utilize the preventative aspect of healthcare and only see the doctor when something is wrong. And so as a society, I think that we have a misconception about what health really is. As opposed to staying healthy, we just treat when we're not healthy. So those are two opinions that I have about it. Other than that, I think that the people that are taking care of patients, doctors, nurses, sometimes get a bad rap about things, and that people have all these conspiracies about wanting people to stay sick. For the most part, nobody goes into medicine because they want people to be sick. They want people to be well. So, in my opinion, that notion comes from the system, not the people themselves, and the way that the system works.
And what would you change or improve about it if you had the possibility to do so?
If I had the opportunity to do something different, it would be one, to focus more on being healthy and like the preventative care that people should be focusing on. Exactly how to do that, I don't know, because I don't necessarily believe in socialized medicine. Our country, I think, is too big, the way that the current structure is, to do socialized medicine. But I feel like, and like I said, I don't know how to get it to this point, but there's like a balance between privatized medicine and social medicine. And I would hope would be some way to find a balance in there so that more people get the care that they need. They don't have to jump through so many hoops to get their care, whether it be because of insurance or because of a lack of resources. So how to actually answer that question is, I don't know. But it's very idealistic and I don't know how to get there.
We are now here with Professor Carr, and she's going to tell us about her perspective on the healthcare system. Professor Carr, what's your perspective on that?
I believe our healthcare system has been broken since COVID. I don't think that it has been financially met with people. I think that it could be a little bit more affordable. It could be a little bit more effective in the fact of being able to make easier appointments for yourself instead of waiting. I have had experiences where I needed to go see a doctor while I was sick and it wasn't always open. I would have to go to a clinic where I would have to pay out of pocket and it wasn't necessarily financially effective for me.
And what would you improve or change about it?
I would make it more necessary to where it fits someone's income within the house. Maybe if they work where they're making $70,000, $60,000 a year, it could work on a level like they would in mental health on that scale, where it wouldn't have to be so outrageously and you have to make payments and it's not necessarily effective. Mm-hmm. Also with the care, I think that the care has been broken only because people have taken advantage of the medicines that have been brought to us. So now, in order for us to get the effectiveness from actually taking care of ourselves in that kind of manner, it's not near as where it used to be before. And now they're having to watch what they give to their patients. I don't know if there's anything that you can actually do about that, but I do feel as if it needs to be more on an open range for people to be able to go see a doctor if they're sick. They don't have to wait a month to see someone. They should be able to get in when it's necessary.
Now we're here with Mr. Herb Oriana, and he's going to tell us what his perspective is on the healthcare system.
Well, in my personal experience, as an elder, as I am, the healthcare system that we now have, I can say is not the greatest. I live on Obamacare. Right now I have what they call Oscar insurance, and I find it very difficult. I find it very difficult when it comes to situations where you're sick or you have to be hospitalized. To be honest with you, the healthcare doesn't really help us much. There is no care for the elderly because it lacks many things as part of the healthcare. All right, we don't have emergency care, we don't have prescription. So I believe that it needs to be revisited, and hoping that with our new president, this could be fixed, hopefully. In my perspective, I believe that something that will really be good, it could be a universal health care system that doesn't cost us anything, that the country can give us a health care, for all adults, for all those who are 65 and over. We can have, free of charge, because we're giving so much to this country that I believe we deserve a little something. And that would be, let's say, one of the questions that you say, how can you improve it? Well, I think that improvement will be to have a health care that is no charge to those who are 65 and over. That would be a great hope.
The issue of the broken healthcare system can potentially be resolved through efforts made to expand accessibility to marginalized areas by the Department of Health and Human Services, mandated classes prioritizing health in schools, and lawmakers enacting health reform policies seeking to eradicate issues in the healthcare system. Actions such as these can allow equalized assistance to the underrepresented individuals, as well as supply employment opportunities to individuals in that area and resolve the problem through universal access to healthcare in the U.S. Regarding mandating classes, it's significant to educate not only children, but adults as well on how to manage and improve their health, recognize signs of illness, and prevent them. Health reform policies seeking to increase individual choice and refine social structures must be enacted to fix the issues with the healthcare system. Implementing these options for the patient will give them more say in what they feel should happen with their care.